This is the BellyUp, the Julie Kay during pregnancy support belt. It is designed to support your heavy belly as well as your hips, back and pelvis during pregnancy. It is soft and comfortable and molds to your specific shape. We don't realize, but we often have a lot of complications during pregnancy, a lot of aches and pains that we need to sort out, that we need support for. The hormone relaxin starts circulating in your body as early as you fall pregnant, which is designed to open up your pelvic ring, but it also acts on all the other soft tissues in your body. You can imagine that everything is kind of destabilizing. So muscles, joints, ligaments, skin, everything is a little bit more relaxed. This can be a little bit more detrimental for back pain because your center of gravity is changing and now that heavy belly is growing forward. It's so important to have decent support while you are pregnant, especially if you are exercising, if you've had previous back issues, complaints, any sort of physical problems with your back and your hips. Correct support is so important. And that's why I've designed this as a physiotherapist to offer the best support possible to your lower back, your hips, your pelvis, as well as that growing belly. So what does the BellyUp really do? By adding back support, hip, and to the lower part of the belly, we're relieving the pressure through your pelvic floor too. The pelvic floor muscles are quite strained during pregnancy as the heavy insides push through these muscles. The BellyUp is designed to lift that pressure up and out of the pelvis and reducing the impact of the heaviness through your pelvic floor. The BellyUp is also easy to wear. It's soft and it forms to your body. The elastic material that it's made of also gives that added support, and change grows with you as you grow during pregnancy. It's also important to remember other things that a support belt like the BellyUp can do for you. We've mentioned lifting the pressure up and out of the pelvic floor, which is so important for incontinence, hemorrhoids or piles, and venous pooling around the pelvis. It's important to lift that up and out and give you that relief, eliminating those kind of complications or severely reducing them. Another thing is round ligament pain. This is pain in the side of the belly, especially as it's growing, stretching that ligament that holds the uterus in place. So round ligament pain is really reduced when you've got support from the lower part of the belly. It also reduces stretch marks, which is quite important. We've got that anti-gravity effect. Although stretch marks are largely genetic and something that one can't really alter, having that reduced pressure through your belly during pregnancy makes a world of difference. It also reduces rectus diastasis, which is splitting of the abdominal muscles. The abs need to move in pregnancy. They have to move to the side. You've got your rectus abdominis sitting here, which need to move to accommodate the growth of your growing baby. What can happen is that we can get a split in the abdominal muscles. That's for increased abdominal pressure, and there can be a split. Often that's due to gravity's effects as well as the internal abdominal pressure. But when you have that lower support, there's less chance of it splitting, which is very important. Because of the back brace and the struts at the back, you're also reducing sciatica, sacroiliac joint pain. We are reducing pubic symphysis pain in front because we're approximating, we're pushing back together those bones in front, which is an incredible painful symptom that we can experience in pregnancy is your PSD, pubic symphysis diastasis. And that's what the BellyUp does. It offers you that outside support, putting pressure on your hips and the lower part of your back to bring that joint back together, eliminating movement at that joint. The BellyUp can be worn as early as you feel any sort of symptoms during pregnancy. Sometimes we fit clients and patients as early as 4 or 5 weeks because it's that hormone relaxin that has done that has exacerbated any sort of back pain that was there, that has just made everything a little bit more unstable or in need of some added support. We can also wear the belly up to sleep at night. I find great results with patients who sleep in their belly up and wake feeling supported. It's also important to remember to sleep on your side if you're having back pain, but we have all these cushions and these big contraptions that we can sleep with. At the end of the day, it's the stability, it's support of your back, hips, and pelvis that is going to be most important, especially when your abs are feeling a little weaker and aren't able to do what they usually can do before pregnancy. Having that support just allows you to turn easier in bed and to move. We can also wear the belly up in exercise. It's very important to remember that when you're exercising, we're bouncing up and down usually, and gravity is just pulling that heavy belly, pulling that pressure through your pelvic floor as well. So support while you exercise is crucial, especially if you are doing your gravity movements, ones that are cardiovascular exercises, running. Please have some proper support. BellyUp will fit you your entire pregnancy long because it's designed to go lower and lower as your belly grows. The same size you order will fit you for the entire pregnancy. Let's take a look at the back of the BellyUp, which is the most important part of this belt. As you can see here, the BellyUp has a double strut support system in your lower back. This molds to the shape of your back and it fits with medical elastic to exactly what your shape is. This is where the pressure needs to be in the BellyUp, is really, really tight and firm around the lower lumbar spine, your sacrum, and your hips. This is the removable elastic strap on the BellyUp. It is very important to know that this comes on after you've fitted the original brace belt like this. So when it's sitting nicely on your lower back, then comes the kicker, which is this added strap to reinforce the pressure that is going through your back. This comes across just like that, from Velcro to Velcro. You can make that as tight as you want to, because that's really what's putting the pressure through that back and reinforcing the hips. It doesn't really matter where you wear the BellyUp. So if you wear it high up on your back or nice and low, it's all dependent on what works best for you. It all depends on where you're feeling your pain, where you're feeling issues, and where it sits comfortably. You don't even need to be in pain to wear your BellyUp. It's important to just have that support as you go along. That is the back of our BellyUp. Now back to the front, just to mention again that the BellyUp needs to be as low to your pubic bone as possible. That's what's lifting the heavy belly up and out of your pelvis. The BellyUp can be worn right to the end of pregnancy. We often have patients and clients who take it off as they're in the delivery room, which is fantastic because it's given them that absolute support and feeling of comfort throughout pregnancy. The BellyUp also comes in black and white. So depending on what you feel, what's best for you, there's a black option and a white option that goes discreetly under your clothing. The BellyUp can be gently rinsed. If you want to wash it, gentle rinse. We treat it like we treat expensive underwear. We're gentle with it. The BellyUp is amazing for what it does for you and the relief that you feel immediately. Sometimes we have clients and patients who aren't even aware that they're in pain or that they're feeling uncomfortable. And the second we put it on, that relief is felt immediately. It's amazing to see that in women, to have that relief, to be believed that they are not feeling great, that there's not great comfort. I firmly believe that we should never ever be in pain. Whether we're pregnant or not, pain is never okay. So it's important to take control of your body, take care of your body, and control your pains, aches and pains throughout pregnancy as well. So this is how we preserve our body during pregnancy, is with the BellyUp Pregnancy Support Belt by Julie Kay. If you have any questions or queries, please don't hesitate to get in touch. We love hearing from you.